PCOS, polycystic ovary syndrome (PCOS) is a condition that affects a woman's hormone levels. Women with PCOS produce higher than normal amounts of male hormones. This hormone imbalance causes them to skip menstrual periods and makes it harder for them to get pregnant. PCOS also causes hair growth on the face and body, and baldness. And it can contribute to long-term health problems like diabetes and heart disease. Birth control pills and diabetes drugs can help fix the hormone imbalance and improve symptoms. PCOS is a problem with hormones that affects women during their childbearing years, ages 15 to 44. Between 2.2 and 26.7% of women in this age group have PCOS. Many women have PCOS but don't know it. In one study, up to 70% of women with PCOS hadn't been diagnosed. PCOS affects a woman's ovaries, the reproductive organs that produce estrogen and progesterone, hormones that regulate the menstrual cycle. The ovaries also produce a small amount of male hormones called androgens. PCOS is a syndrome, or group of symptoms that affects the ovaries and ovulation. Its three main features are cysts in the ovaries, high levels of male hormones, irregular or skipped periods in PCOS, many small, fluid-filled sacs grow inside the ovaries. The word polycystic means many cysts. These sacs are actually follicles, each one containing an immature egg. The eggs never mature enough to trigger ovulation. Extra male hormones disrupt the menstrual cycle, so women with PCOS get fewer periods than usual. Symptoms of PCOS. When you have PCOS, you may be experiencing several seemingly random, unrelated symptoms. PCOS affects your hormones dramatically, so you may experience these symptoms: hair loss from your scalp and/or hair growth, hirsutism in unexpected places, oily skin and acne problems, infertility, ovulation problems or repeat miscarriages, weight gain, especially around your waist, menstrual problems, depression and/or mood swings. Your doctor might then recommend a pelvic exam. The doctor visually and manually inspects your reproductive organs for masses, growths or other abnormalities. Blood tests. Your blood may be analyzed to measure hormone levels. This testing can exclude possible causes of menstrual abnormalities or androgen excess that mimics PCOS. You might have additional blood testing to measure glucose tolerance and fasting cholesterol and triglyceride levels. An ultrasound. Your doctor checks the appearance of your ovaries and the thickness of the lining of your uterus. A wand-like device, transducer, is placed in your vagina, transvaginal ultrasound. The transducer emits sound waves that are translated into images on a computer screen. Treatment. PCOS treatment focuses on managing your individual concerns, such as infertility, hirsutism, acne or obesity. Specific treatment might involve lifestyle changes or medication. Lifestyle changes. Your doctor may recommend weight loss through a low-calorie diet combined with moderate exercise activities. Even a modest reduction in your weight, for example, losing 5% of your body weight, might improve your condition. Losing weight may also increase the effectiveness of medications your doctor recommends for PCOS, and can help with infertility. Medications to regulate your menstrual cycle, your doctor might recommend combination birth control pills. Pills that contain estrogen and progestin decrease androgen production and regulate estrogen. Regulating your hormones can lower your risk of endometrial cancer and correct abnormal bleeding, excess hair growth and acne. Instead of pills, you might use a skin patch or vaginal ring that contains a combination of estrogen and progestin. Progestin therapy. Taking progestin for 10 to 14 days every 1 to 2 months can regulate your periods and protect against endometrial cancer. Progestin therapy doesn't improve androgen levels and won't prevent pregnancy. The progestin-only minipill or progestin-containing intrauterine device is a better choice if you also wish to avoid pregnancy. To help you ovulate, your doctor might recommend clomiphene, Clomid. This oral anti-estrogen medication is taken during the first part of your menstrual cycle. Letrozole, Femara. This breast cancer treatment can work to stimulate the ovaries. Metformin, Glucophage, Fortimate, others. This oral medication for type 2 diabetes improves insulin resistance and lowers insulin levels. If you don't become pregnant using clomiphene, your doctor might recommend adding metformin. If you have prediabetes, metformin can also slow the progression to type 2 diabetes and help with weight loss. Gonadotropins. These hormone medications are given by injection. To reduce excessive hair growth, your doctor might recommend birth control pills. These pills decrease androgen production that can cause excessive hair growth. Spironolactone, aldactone. This medication blocks the effects of androgen on the skin. Spironolactone can cause birth defect, so effective contraception is required while taking this medication. It isn't recommended if you're pregnant or planning to become pregnant. Eflornithine, Vanica. This cream can slow facial hair growth in women. Electrolysis. A tiny needle is inserted into each hair follicle. The needle emits a pulse of electric current to damage and eventually destroy the follicle. You might need multiple treatments.